Now, a suspected Ebola case has triggered a health alert in Bengaluru after a 28-year-old woman from Uganda was admitted to the state-run epidemic diseases hospital with mild symptoms. Now, according to health officials, the woman had recently traveled from Uganda to Ahmedabad before arriving in Bengaluru. And authorities have said that she did not show any symptoms during the airport screening. However, due to her travel history from an Ebola-affected region, surveillance teams continued monitoring her condition. Officials said that the woman later developed mild body ache nearly 24 hours after arrival, following which she was shifted from a hotel to the designated treatment facility. Now, samples have now been collected and sent to the National Institute of Virology or the NIV in Pune for testing. And doctors say that the woman is currently stable and has not developed any additional symptoms so far. Health officials added that even if the first test comes back negative, a second test will be conducted after 48 hours as part of standard Ebola monitoring protocol. She will be discharged only after testing negative twice. Amid the alert, Karnataka's health department has activated precautionary measures and designated specialized isolation, quarantine and treatment facilities in Bengaluru and Mangaluru. The preparedness measures come after the Union Health Ministry directed all states and union territories to strengthen surveillance and hospital readiness in view of the ongoing Ebola outbreak in parts of Africa. The World Health Organization has already declared the Ebola outbreak in Uganda and the Democratic Republic of Congo a public health emergency of international concern. Well, what we are telling our viewers right now is that a suspected Ebola case has triggered a health alert in Bengaluru as a 28-year-old woman from Uganda was admitted to the state-run epidemic disease hospital with mild symptoms. Now, although the first test may have turned out to be negative, but the second test would be carried out 48 hours after the first test because sometimes the symptoms gets more noticeable after 48 hours. Now, according to the health officials, the woman had recently traveled from Uganda to Ahmedabad before arriving in Bengaluru. Now, authorities did say that she did not show any symptoms when the airport screening took place, but they still kept her under surveillance due to her travel history. Now, officials say that the woman later developed mild body ache nearly 24 hours after arrival, following which she was shifted from a hotel to the designated treatment facility. Samples have now been collected and sent to NIV, which is the National Institute of Virology in Pune, for testing. And doctors say that the woman is currently stable and has not developed any additional symptoms so far. But remember, the health officials are being very, very careful. They are monitoring all the symptoms of this particular woman very carefully because the first test comes back negative does not necessarily mean that she does not have Ebola, because the second test would then be followed up after 48 hours as the standard Ebola monitoring protocol. She will be discharged only after testing negative twice. That is the standard procedure followed for Ebola. Now, amid the alert, the Karnataka Health Department has activated precautionary measures and designated specialized isolation, quarantine and treatment facilities in Bengaluru and also in Mangaluru. But remember, she did go to Ahmedabad before coming down to Bengaluru. So, if at all she shows any symptoms of Ebola, it is going to be difficult for the authorities in Gujarat as well to try and trace or do any sort of a mapping as far as where all she traveled, who did she come in contact with. Those are the areas of concern that might affect more than one state. Then it may not just be limited to Karnataka. It might also rope in Gujarat authorities then. But we are waiting to see whether what is going to happen after 48 hours when the second test, the follow-up test, is going to be carried out on the patient. And it is only after 2 negative tests that the woman concerned in question can be put on the clear. The preparedness as far as Ebola monitoring system is concerned comes after the Union Health Ministry directed all states and union territories to strengthen surveillance and hospital readiness in view of the ongoing Ebola outbreak in parts of Africa. Remember, it was only a few days ago that the World Health Organization declared the Ebola outbreak in Uganda and the Democratic Republic of Congo a public health emergency of international concern. If any strain of Ebola ends up entering India, it's going to be a matter of a deep concern. Although the authorities at the state level and the central level, as far as the health administration and the ministries in concern are concerned, they are carrying out a close surveillance on all the symptoms of this particular 28-year-old woman, who has now been shifted to the epidemic diseases hospital when she showed mild symptoms after 24 hours of her arrival in Bengaluru. Remember, she recently travelled from Uganda to Ahmedabad before arriving in Bengaluru. And to discuss this further, I'm joined by Dr. Ishwar Gilada, who is a consultant, Secretary General, People's Health Organization. Thank you so much, Dr. Gilada, for taking your time and joining me here at Newsline. Good afternoon to you. We are talking about a 28-year-old woman, Dr. Gilada, who seems to have showed certain mild symptoms, although her first test, as far as Ebola scanning is concerned, that has come out to be negative, but the authorities are taking no chances. They are going to be carrying out another test in 48 hours time to see whether she is still testing negative or not. But what about the fact that she did go to Ahmedabad and then landed over here in Bengaluru? What we are putting across to our viewers is all steps being taken by the Karnataka authority. But if she's gone to Ahmedabad, then do you feel there is a need to try and trace the contact tracing or the contact mapping if this woman is concerned?
See, first and foremost, our policies are little lax. How did this woman board the aircraft which comes to India? So if you look at the US policy currently, no non-US person can travel from any of the countries like Uganda, Zaire, or DRC Congo, and Sudan. And even if that person is non-US, that person is coming on the aircraft was shifted. There was an Air France aircraft which was going from Paris to Detroit yesterday, and that was changed to go to Montreal because of US policy. Now, if we talk about India, there is no direct flight between Uganda and India or DRC Congo and India. So they will obviously come through
I can
Gulf countries.
interject because the authorities are saying that at the airport screening, she showed no symptoms. So what happens then if a person at the airport screening is not showing symptoms, but then it ends up developing further as far as symptoms are concerned, and in 24 hours to 48-hour window, the symptoms start surfacing?
No. The symptoms can come within 2 to 21 days. It is not only 48 hours.
Okay.
So it is not like COVID. So if the person is suspected, that person needs to be isolated, quarantined for 3 weeks, minimum 3 weeks. Now, if that person has already come in contact with other people who are her passengers, co-passengers, or in the lounge or in some waiting area, then those people are also suspect. But at least good thing with Ebola is not transmitted so easily through respiratory tract. It can be transmitted through close bodily contact, close bodily fluid. So it is basically person-to-person contact, which is in close vicinity, or a sexual contact, or family contact. So I think the risk to transmission from her to somebody else is low, is not very high. But my first question is how that woman land in India. Why did we don't have a policy that the people from Uganda or DRC Congo, whether they are suspected or not, currently because of this outbreak, they cannot travel to India. And we must make that kind of policy very strict now itself. Otherwise, this is one case, but there can be other people coming. India is 1/6 of the world population. Any problem anywhere in the world can very easily sneak in India.
Point taken, Dr. Gilada. One thing is about lapses on the part of the authority, but I want to understand from you, and for the better understanding for viewers also, Dr. Gilada, is that what are the symptoms that one must look forward to? How is Ebola different from COVID, like you just mentioned, and whether this is treatable? Because we are not here to spread panic. We only want to try and make informed decisions as far as our conduct and our travel is concerned.
So first and foremost important, the
Okay.
symptoms are like initially flu-like symptoms. So fever, cough, sore throat, headache, body ache, pain in muscle, pain in body. Thereafter, they get respiratory distress sometimes, but most of the time is a hemorrhagic fever. Hemorrhagic fever means there is a bleeding, internal, external. If there is external bleeding, you can see bleeding marks on body, on the skin, and there can be renal failure. So these can all happen within 2 to 21 days. Number two, there is no perfect treatment for Ebola. Whichever variety, whichever strain it has. Currently, it is said to be the variety called uh, no, it's not a Zaid variety, the uh, Pandibugyo, Pandibugyo variety. For that, there is no cure, there is no vaccine. So therefore, we are all scared. And the death rate is between 25 to 90% with all historical outbreaks, whatever has happened globally.
This is not the first time around that Ebola strain has found itself in India. If you can throw some light on that front, and also how contagious is it? How does it spread?
So there are actually six strains of this virus, Ebola virus, out of which four are they can cause infection in human being or human to human. Out of which the most common earlier was Zaire strain and Sudan strain. But thereafter, there is a new strain which has been there have been total 13 outbreaks historically from 1976. Out of which the two outbreaks were only from this new strain, and this is the third outbreak. And currently, if the person comes in contact with other people, close body contact, then that person can transmit infection either through bodily fluids, blood, urine, stool, or saliva, but not respiratory infection, just like we have seen in COVID. Therefore, if you see on one hand, it is a fatal infection, there is no treatment, there is no vaccine, there is no cure. On the other hand, it is less transmission as compared to COVID, so therefore there is no need to panic. But the first and foremost, the person has come in India. Now the person is suspected to be having this infection, Ebola. We need to quarantine that person and we need to be careful while caring the person. And that care has to be there in the medical caregivers, doctors, nurses, technicians, ward boys, ayas, etc. And they should use PPE kits because we know very little about this virus, though it has been around for almost 50 years.